I am Yoji Kamura. I am IT Communication Officer in Japan. We are talking about effective use of PEEK in daily practice today. Today's agenda: introduction, patient removal bridge with PEEK and zircon bridge, full arch and unilateral, full denture and partial denture, implant custom abutment with PEEK material. This photo is our dental digital team. We are 4 dental technicians, 8 dental hygienists, 5 dentists, and 1 wife. You can see a journey with ITI. I have been an ITI fellow since 2008 and a communication officer since 2018. I like running. I have participated in full marathon race since 1998, 1995. I am a communication officer for advertising IDEA Japan activity. A president of Stroma Japan presented me running wear for advertising Stroma and ITI. I participate Olympics Games full marathon. I think worldwide people see this TV program. I can promote ITI and Stroma as an ITI communication officer. This is me. I want to introduce contribution to ITI. I have been an ITI fellow since 2008, so I posted my clinical cases to ITI website almost every day. These are my contributions as ITI fellow. This is my clinical case. If you are ITI members, you can see this slide in today.
In this case, the patient requires a periosteal releasing incision in the anterior maxillary region to achieve tension-free wound closure following grafting and simultaneous implant placement procedures. This case demonstrates the scissors technique for releasing the periosteum. A full-thickness mucoperiosteal flap has been raised with vertical releasing incisions adjacent to right central incisor and left lateral incisor. The flap is extended apically beyond the mucogingival junction. A black silk retraction suture has been used to maintain reflection of the palatal flap. Using a second retraction suture and fine tissue forceps, the flap is gently pulled buccally, providing clear visibility of the undersurface of the flap.
From then, we tried digital treatment, so we were invited from Europe, Budapest, Hungary, and Vienna, Austria. You can see the video in Hungary, Semmelweis University. What about my presentation? We had a presentation, digital implant treatment in Hungary, and we had a presentation, same topic, topics in Vienna, Austria.
わかんないけど。
We had online IT study club
Thank you.
every Wednesday.
Connective tissue around
Japan time.
implant contain collagen fibers that orient primarily perpendicular to the implant surface,
Dr. Zenhua,
similar to periodontal tissue folds.
Charco, attending every
because
week.
similar to periodontal.
Thank you for very
そうだ
much,
ね。はい。
Dr. Jennifer.
うん。ね。
はい。
Because it's perpendicular but not is similar.
She is very
Yeah.
famous
はい。
dentist in Peru, I think.
Which of the following statements is most correct in
I will show you about patient removable bridge. By utilizing CAD/CAM technology, materials such as zirconia and PEEK can be freely modeled with high precision. The characteristics of patient penetrative bridge, patient removable bridge, as double crowns using zirconia and PEEK for detect defect prostheses are shown below. Patients who do not want an implant surgery but want a fixed prosthesis, moderate retention, and applicable to cases involving both implant teeth. No need to extract multiple teeth or remove large amounts of jawbone with oral hold protocol. Easy to repair prosthesis, good cleanability. Ideal for prosthetics in a super aging society. But we can get AGC copying from partner dental laboratory, so we try to other materials for patient removable double crown. We think the bridge is good for cleanability. We got new milling machine MSI Core Stroma. We found out peak for double bridge milled with new milling machine. Peak, we found the peak. Peak is a member of allyletic ketone family, PEEK family. P is classified to super engineering plastic. Peak and PEEK is top of the this family. For example, PEEK is used for car and gear, car and airplane, and used for femur and skull, and dental implants. I emphasized that elastic module of PEEK is close to dentin and cortical bone. And this is a very important factors. In this paper, zirconia combination between zirconia inner crown and PEEK outer crown shows high and consistent retention. This red line shows in 1000 cycles about 10 years daily detachment retention is stable. We decided this combination is best combination for patient removable prosthesis. You can see first clinical situation in this case. Six implants were pressed in edentulous mandibular, and full ceramic bridge was set in maxilla. This is full breach in this case. You can see definitive restoration in this case. I played situation lasts forever, but after 6 years, he lost maxillary bridge, unfortunately. And this is a condition of detachment of full arch ceramic bridge. This is CAD design of zirconia and PEEK bridge. This software is Stroman Care's visual. You can see the video of fabricating of inner zirconia crown and outer PEEK bridge. After digital impression, Trios CAD design of inner zirconia was performed. After designing of inner crown, outer PEEK bridge was designed with CAD-CAM software. These are the design results of PEEK outer bridge. The frame was cut back for veneering material. This is the result of milled PEEK. This PEEK disc was delivered from Shofu, Japan. One disc cost $600. The framework was milled IMSI core. You can see the retention of this bridge. We find moderate retention. You can see the zirconia inner crown and PEEK outer crown. Framework was veneered with hybrid resin, hybrid ceramics, shofu. And this is the definitive restoration in these three models. You can see the oral conditions. After setting zirconia inner crown, gingival health was improved dramatically. In my cones type crown case, zirconia crown has high biocompatibility. Hybrid ceramics, flowable resin, ceramage, shofu was veneered to teeth and gingiva. In full smile, you cannot see the border between pink ceramic and gingiva. You can see the final results in the panoramic gradual graph. After 3 years, the occlusal surface is PEEK, but no major wear is seen. Polishing of antagonist prosthesis is essential. I have seen PEEK wear due to lack of antagonist polishing. In this paper, Abu Hai reported that PEEK does not wear out to enamel as antagonist than zirconia. You can see a blue space. In terms of material itself and the antagonist PEEK is considered to be a more ideal prosthetic material as there is less reduction in vertical dimension compared to zirconia. PEEK is better than zirconia, I think. Because hardness, PEEK is similar to enamel and dentin than zirconia. Is familiar to biocompatibility. Next case, tooth and implant combination. Patient removable double crown is PEEK and zirconia is suitable for in this case. He used removable denture and we take vital registration in 3D printer model. You can see the occlusal condition in maxilla. We made zirconia inner crown and titanium inner crown. This is zirconia inner crown. And this is outer PEEK crown, like bridge. This is PEEK bridge. And this is completed prosthesis after hybrid resin veneering. You can see the final restoration. This kind of double crown is applicable to cases involving both implant and teeth. Teeth and implant. You can see the occlusal view in this case. In this type of prosthesis, new abutment can be added. We think that for 6 implant abutment is needed in full bridge. It doesn't matter if it is an implant or a natural tooth. We can accept implant and natural tooth. PEEK bridge is easier to repair to add the abutment than zirconia bridge. You can see the change before and after abutment addition. In this case, we can confirm slight wear on the occlusal surface, and we recommend this prosthesis because of good cleansability. This prosthesis is ideal in superaging society because of needing nursing care. Next case. 4 implants were placed in posterior mandibular for fixed prosthesis 2016. Unfortunately, tooth number and implant number 36, 33, 32, 31, 41 were lost in 2021. She desired a fixed prosthesis. These are 6 years change in her dentition. Left slide is 2015, right slide 2021-22. G9 yellow crown were fabricated in teeth and implants. Peak outer crown was made to fit inner crowns. Occlusal surfaces were veneered with hybrid resin. 小風 ceramage, inner crown and outer crown. And inner crown and outer crown in 3D model and had occlusal condition. And this type of prosthesis, advantage of this type of prosthesis advantage. Inner zirconia crown and outer peak bridge. First, periodontal health. Two, secondly, minimal invasive. And next, patient who need nothing care. Fourth, patients who reject implant treatment. Fifth, implants who needs fixed prosthesis.